Hi there, thanks for clicking the video. I'm Eric from Brain and Body Health, and I just wanted to peel back the curtain and show you exactly what a therapy session with us looks like for low back pain. One of the biggest problems we hear about with therapy today in healthcare is that if you see one chiro or physio and then a second chiro or physio, you're going to get a completely different set of treatments from each practitioner. Now, at Brain and Body Health, we try and follow the most up-to-date evidence-based approach for therapy. So to show you exactly what that looks like with us, keep watching and you'll get to see how we treat low back pain, as well as an explanation for why we're doing certain techniques. Thanks for watching. Hey guys, so I'm Eric from Brain and Body Health. This is Cal. So if you work out at the local F45 Gladesville, you know who he is. He's one of the trainers there. But Cal's come in with a bit of a boo-boo. His low back gets a bit ouchy whenever he's doing Russian twists, which is a problem because he's a Superman with everything else. So it's his one weakness. Russian twist, kryptonite. We got to fix that. Now we've done a gait analysis with Cal, and what we found is that his hips are a little bit locked up. So when he's walking, he can't extend properly through the hips. So because he doesn't want to walk like a penguin, the cheat for that is if his hips aren't opening up, he starts to get a twist with the pelvis every time he's taking a step. Now the reason why that's important is every time he does that, he's wrenching on his discs in his low back, and that's irritating the area and making it very hard when he's doing something like Russian twists, because he's already irritating the discs with every step that he takes. Now the other reason why it's important is we want to fix this, but we also want to make sure that it stays fixed. So if we don't do something about the way that he walks, the way that Cal walks, what's going to happen is we'll get him out of pain, but then 3 weeks later it's going to come back, and then we'll get him out of pain, and 3 weeks later it'll come back, and then we'll get him out of pain. So if that happens, we're stuck in a loop and we're not really fixing anything. So we want to look at getting out of pain as quick as we can, but then making sure the pain stays gone so that Cal can work on those obliques to match everything else. That's just stunning perfection. Yeah, let's get stuck into it. So, mate, let's just redo that Russian twist maneuver, because I know that's the one that you love so much. So first thing we need to try and do is establish pain levels. So we're going to do the Russian twist. It was this side, wasn't it? Yeah, cool. So go for it. Okay, so move it and then hold it there. Yeah, cool. So pain out of 10, mate.
4, 5.
4, 5 out of 10?
Yeah.
Okay, we'll go with 5 because it's better for the camera. So pain's a 5 out of 10. I mean, lose the hat. Come on, we're inside.
My hair is...
Oh, mate, you're beautiful. Don't worry about it. So 5 out of 10 with Russian twists. Let's check a few other movements. So, mate, if you can just stand up and be awkwardly close to the camera. So face me. Reach for your toes. Okay, any pain or restriction there?
No, tightness, but no pain.
Tight. And where are you feeling it tight?
So, in the glute, in the back.
Glute and back? Okay, back on one side or the other?
On the right side.
Back on the right? Okay. And let's go backwards as far as you can. Any pain with that one? Beautiful. So it's going forward. What about rotating? So rotate as far as you can.
Fine.
It's fine. Other way. All good?
Tight.
Bit tight. And the same spot? That right. Okay, cool. So we figured out that going through his toes causes some tightness in the right low back. We also get pain in the movement, the Russian twist movement, and a little bit with rotation in that right low back spot. So what we're going to do now is flush that area out. We're going to look for any scar tissue adhesions that have built up in the area. So I'll get you to lie face down there. So this is just a massage tool that we use to look for unhealthy tissue. So what I'm looking for is anywhere under the tool that feels a little bit gravelly. So that gravel is where the muscle has been so over tight for so long that it's started to get some scar tissue debris laying down in the area, and that's a bit of a problem because the scar tissue then, first of all, it prevents the muscle from doing its job properly, but it also causes things like fascia to get stuck to the area. It can cause nerves to get snagged. So we want to find those gravel spots and flush out the scar tissue so that the tissues can start to move independently and move a little bit more healthily. It's also good for blood flow and a few other bits and pieces, but we found that by working on getting rid of the snag spots first, we get a big improvement in the quality of the movement in the area, and it also means that getting out of pain becomes a lot easier, but it also means that when we get to the stage of strengthening up the glutes, so with the twisting with the hips, it causes a lot of glute med and glute max weakness that we need to address. So if his back's super locked up and we try and do some rehab exercises, we're not going to have much luck getting good muscle activation. So that's where we need to make sure mobility and pain is decreased as much as possible before we start to do exercise. And ideally we want to do exercise rehab straight away, because we find by doing the muscle activation immediately after getting the pain out of the way and improving mobility, the effects of what I'm doing right now last a lot longer. Whereas if we were to just do this and then not do the exercise straight away, the treatments seem to not be quite as effective as when we do the combo. So we also found with the way that Cal walks that every time he stands on one leg, he gets a bit of a towering with his spine, which is an indicator that his obliques aren't activating as well as they should. And so when we look at his obliques in a bit of detail, we're finding some gravel in the attachment points for his obliques through his iliac crest. So we want to make sure that we get the obliques as healthy as possible. One, to improve the way that he walks. But also our obliques are a major muscle that work with Russian twists. So seeing as Russian twists are our goal, we've got to make sure that these circles are working. So now that we've flushed the area out, we've got the tissue, the muscles that are a little bit locked up with scar tissue flushed out. We've also gotten the joints that are a bit seized up in his low back freed up. We're now going to look at improving flexibility a bit more. See if we can open up his hips with the way that he's walking by stretching out his quads, which are pretty tight. Grip hold. Okay, so do it and hold. Okay, so out of 10 now, mate.
3, 2, but that's pretty
Beautiful. Give it a note. I'll give it added. So that the pain's now dropped down to a 2 out of 10, which is great. So we want to add a bit more resistance, push it a little bit harder, and see if that changes the pain at all. So a bit tougher. Go for it, mate, and then do it isometric. Good. Okay. Does that make it worse?
makes it a bit worse. The holding.
The
is
holding's
harder.
definitely a challenge. Yeah. Okay.
But
Cool.
not as much pain.
So we've dropped pain by more than 50%. Now let's do some exercise to activate the glutes, give them a bit more stability. See how much that changes it. Cool. So drop that. So again, with the Gait analysis, we found that glute med was Cal's main weakness in the glute muscle group. So we're going to try and do some glute med activation. Cal, super strong guy, but really struggles with his glute med exercise. So ideally, we'd have a band around his knees, but we're just not up to that stage yet. Research also shows us that when we're looking at improving the strength of an area, but we want that strength improvement to translate into other exercises. So we're doing this exercise hoping that this strength will translate into the way that he walks, because if we just do sets and reps, the traditional way of strengthening up a muscle, what we'll find is Cal gets really good at lifting his leg up, but it doesn't really translate to an improvement in the way that he's walking. So if walking is the main goal for us at the moment, because if we don't fix that, we haven't really fixed it. Head at the other end, mate. Actually, no, you can roll over. Make it easy.
Sure.
Yeah, face this way. That way everyone can just get a good booty shot. That's what they're here for, mate. Beautiful. So minute-long contractions, the isometrics for the glute med, research shows translates to an improvement in activation with things like walking, but also with any other exercise. So by doing this, we're going to see that the glutes become more active, both with walking, but also with Russian twist, which is the main exercise that we're trying to affect. This is also about the second take. Yeah, so this is Cal's third visit. So the pain was actually a bit worse a few visits ago, but I did a rubbish job of videoing it. So this is a redo. Now, Cal's a strong guy, so I'm pushing him pretty hard. So the concepts that we're looking at, where we want to improve pain, decrease pain, improve mobility, and improve stability. So whether you're a 90-year-old grand or a super fit 20-something-year-old, we're going to run through that same protocol because that's the evidence-based, the most effective way of treating low back pain in this case. 20 seconds left, mate. So while Cal's a strong guy, if you're not in your mid-20s and a super fit athlete, we're not going to work you quite as hard as this. We tailor it to your fitness level. 5 seconds, mate. So again, Cal's super strong guy, can do squats for days, but struggling to hold his leg up. So that means we're on track, and we found the thing that's causing a lot of his long-term dramas with his back. Rock forward a bit more. There we go, mate. So again, we can get stronger at this. We should see not only Russian twist get a lot easier, but we should see things like his squat gets a lot stronger, and any other exercise that he really wants to improve that uses the low back gets a lot better. But again, the biggest one is let's make sure the pain stays gone, it doesn't come back, and that's beautiful. Game over, man. Let's Russian twist again, mate. See how that is. That's right. Just keep the village around. It's fine.
I can't be blamed for what I do after that.
So Russian twists and holds. Okay, out of 10?
2, if that.
2? Okay, cool. So strength's getting better. We've dropped the pain down by more than 50%, so that's a good day in the office. So we should see over the next couple of visits that the pain goes pretty quickly. And as that strength in the glute med gets better and better and better, the chances of the pain coming back drop down and down and down and down. Mate, good job. High five. Cool. So I hope you enjoyed that and you've got an idea about what we do at Brain and Body Health now. So I've developed a 3-step protocol for people with low back pain on what you can do at home to get some relief. And if that's something that interests you, if you could just comment low back relief, I'll send you a copy of that ebook ASAP. Thanks for watching.